Welcome to today's lesson. In this video, we'll explore the cardiac cycle, the sequence of events that happens in your heart with every single beat. We'll look at systole, diastole, pressure changes and how the heart valves make sure blood flows in the right direction. The cardiac cycle is the series of events that occur during one heartbeat. At rest, one cycle takes less than a second, about 0.8 seconds, and it repeats over and over to keep blood circulating around the body. The two main phases are systole, when the heart contracts, and diastole, when the heart relaxes. Let's begin with diastole, or the relaxation phase. Here, both the atria and ventricles are relaxed. The atrioventricular or AV valves, the tricuspid on the right and mitral on the left, are open, letting blood flow freely into the ventricles. Toward the end of diastole, the atria contract in what we call atrial systole, giving the ventricles one last push of blood. At this point, the ventricles are full, containing about 120 milliliters of blood. That is called the end diastolic volume. Next comes ventricular systole, the contraction phase. This happens in two steps. First is isovolumetric contraction. The ventricles squeeze, pressure rises, and the AV valves snap shut, producing the familiar first heart sound or lub. At this point, all valves are closed and no blood leaves yet. Then comes the ejection phase. When ventricular pressure becomes higher than the pressure in the aorta and the pulmonary artery, the semilunar valves open and blood is pumped out. Each ventricle ejects about 70 milliliters, known as the stroke volume. What's left behind, around 50 milliliters, is called the end systolic volume. After contraction, the ventricles relax in ventricular diastole. In isovolumetric relaxation, pressure inside the ventricles drops, causing the semilunar valves to close. That closing makes the second heart sound or dub. When ventricular pressure falls below atrial pressure, the AV valves open again and blood flows back into the ventricles. The cycle then starts all over again. Throughout the cycle, pressure inside the chambers is constantly changing. Atrial pressure is usually low with a slight rise during atrial contraction. Ventricular pressure, especially in the left ventricle, shoots up as high as 120 millimeters of mercury during systole and drops near zero in diastole. Meanwhile, aortic pressure stays fairly high, about 120 over 80, with a small dip called the dicrotic notch when the aortic valves closes. In this slide, a Vigor's diagram is shown. A Vigor's diagram showing the cardiac cycle events occurring in the left ventricle. In the atrial pressure plot, wave A corresponds to atrial contraction. Wave C corresponds to an increase in pressure from the mitral valve bulging into the atrium after closure, and wave V corresponds to passive atrial filling. In the electrocardiogram, wave P corresponds to atrial depolarization, wave QRS corresponds to ventricular depolarization, and wave T corresponds to ventricular repolarization. In the phonocardiogram, the sounds labeled first contributes to the S1 heart sound and is the reverberation of blood from the sudden closure of the mitral valve, left atrioventricular valve, and the sound labeled second contributes to the S2 heart sound and is reverberation of blood from the sudden closure of the aortic valve. The valves play a critical role in keeping blood moving forward. The AV valves are open during filling but close tightly during systole to stop backflow into the atria. The semilunar valves stay shut during filling but swing open during systole, then close at the start of diastole to stop blood from flowing backward. Let's quickly summarize. Atrial systole, AV valves open, semilunar closed. Isovolumetric contraction, both valves closed, producing the lub. Ventricular ejection, semilunar valves open, AV closed. Isovolumetric relaxation, both valves closed again, making the dub. ventricular filling, AV valves open, semilunar closed. And that's one complete heartbeat. So that's the cardiac cycle, a beautifully coordinated process that keeps your blood flowing with each heartbeat. If you found this helpful, don't forget to like, share and subscribe for more medical education videos. Thanks for watching.